I rise today to speak in support of the Drugs, Poisons and Controlled Substances Medically Supervised Injecting Centre Bill 2023. There is overwhelming evidence to show that the medically supervised injecting room saves lives and provides pathways out of drug dependence for people who use injecting drugs. It is on that basis that the Greens support this bill, which will enable the safe injecting room to continue its work into the future. Having lived in North Richmond before the centre was established, I saw firsthand the growing use of drugs in public space and often removed syringes from my doorstep. The medically supervised injecting room was since established in response to community calls for a health-based response to the growing injecting drug use, overdoses and deaths in the area. Let me say emphatically that the North Richmond Community Health Centre has done an extraordinary job in developing and managing the centre and all of the complexity that entails. Every time I've visited the site, I've been blown away with the breadth and complexity of the service that it provides and the care, professionalism and compassion that its staff display. The medically supervised injecting room also provides critical wraparound services, including treatment for hepatitis C, long-acting opiate replacement therapy, dental care, housing, legal and employment support. Given its incredible success in preventing overdoses, it is concerning that this government now appears to be backing away from its commitment to establish more safe injecting facilities, which will continue to see North Richmond unfairly burdened as the only supervised injecting facility in the state. Evidence shows that we need safe injecting facilities in health centres across the state, including in the CBD, in St Kilda, in Geelong, in Dandenong. In the CBD especially, drug use and overdoses show no sign of decline. Every day that we delay, more people are at risk of overdose and death. Community health providers are saying that things are as bad, if not worse, than they were before COVID. The government has bought a building for a community health service, incorporating a discrete supervised injecting room, but now it is beating around the bush as to if and when that supervised injecting room will be established. This is most concerning. Studies of more than 120 safe injecting services around the world, some of them which have been operating for decades now, show that they are one of the most effective tools in combating the serious harm caused by drug dependence in our communities. Every day in Melbourne, people are risking death by injecting drugs on the streets, in parks, in laneways, in public toilets. Approximately one person a month dies after using heroin in the city of Melbourne. These deaths are unnecessary. These deaths are preventable. They are people loved and mourned by families and friends. An alliance of 120 CEOs from organisations across the health sector, unions, legal centres, social services and youth services are calling on the government for an urgent establishment of a second health centre in response to the crisis in the CBD, saying our response as a community to this health issue should be a health solution underpinned by care, support and compassion. Given the expertise on the list of signatories, I can only echo their concerns and urge the government not to back away from pursuing evidence-based harm reduction in establishing more centres. We also need to make sure that we look after the North Richmond community. They've told me that they are struggling. The residents in public and private housing, those who work in the local businesses. The government has said that they will commit to investing in the safety and amenity in North Richmond. And if this government is serious about a health-led approach to drug solutions and addressing amenity issues in North Richmond, they need to establish another centre. They need to invest in public housing and public health. They need to give our community service organisations the sustained and secure funding that they need to support vulnerable people. And we need to see a significant sustained investment in the North Richmond precinct, with permanent community and public spaces, with streetscaping, with resident support and investment in local business. We also need to see investment in the arts, the community and the cultural life of North Richmond. The government must make sure that safety and amenity in North Richmond is prioritised. And I ask, as the member for Richmond, to be part of the conversations that this government has into the future about the future of North Richmond. Regarding the bill in front of us, the Greens do hold some concerns, including that the legislation does not follow all of the recommendations of the Ryan report regarding the need to remove barriers and expand eligibility criteria and address peer and partner injecting. The Greens look forward to constructive conversations with the government about strengthening this bill, investing in North Richmond and establishing more safe injecting rooms across the state.